My name is Cheyenne, and I'm an oncology registered nurse in Northwest Indiana. And although my healthcare facility doesn't formally recognize a clinical nurse leader as an official job title, the skills I've adopted training for this role are pivotal in my everyday patient care. My job requires compassion, precision, and excellent critical thinking skills, as well as my ability to assess patient risk, independently implement evidence-based interventions, and assess those outcomes based on those interventions. On my unit, it's not uncommon to see patients coming into the hospital with one ailment just to find out that they have cancer, usually at an advanced stage when they're in poorer health and have fewer treatment options. And during the pandemic, this has become even more commonplace with a significant decline in patient screenings. At this point, patients and families may opt for things like palliative care or, in the worst case, hospice due to their advanced disease, poor or terminal prognosis, and poor outcomes. And while many of our oncologists are very supportive of their choices to pursue end-of-life care or withdraw from or withdrawal of treatment, many are quick to encourage further treatment to try and regain any of their lost life that they can. This often leaves patients feeling vulnerable and confused about their options, unsure of how they proceed, and a skilled clinical nurse leader like myself has been the perfect solution to this problem. I recently cared for a patient newly diagnosed with AML. She completed chemo and a clinical trial at a major university hospital, but continued to see one of our oncologists for checkups and urgent matters, most recently a fever. After several days in the ICU, she was transferred to our floor hoping for discharge, but immediately expressed concerns over the lack of communication she received from her time of admission, the fact that her ICU nurses couldn't share her concerns with the rest of the healthcare team, and her concerns with trusting her providers to adequately treat her moving forward. She didn't really feel like her healthcare providers could address her impending cold, nonetheless provide her with any sort of life-altering treatment. So I pulled a chair to her bedside and explained that I couldn't solve all her problems, but wanted to hear her concerns, address what I could, and refer where I couldn't. And we did establish that her biggest challenge was that her team was very large, but didn't seem to all be on the same page. She could tell her nurse one thing, but it seemed like her doctors never got the message. Her infectious disease doctor would tell her one thing, but internal medicine would tell her something completely different. She had very specific goals of care and were not amenable to any other kind of treatment until those were factored in and everybody was on the same page. She was incredibly accepting of the fact that she might die someday, but she wanted to do it on her own terms, and she couldn't do that without knowing some critical pieces of information about her diagnosis, her treatment, and her prognosis. So we discussed palliative care, and with her expressed interest, I placed a referral, and I made sure she knew how critical and important it was to make sure that her needs were met and her questions were adequately answered. I empowered her to be bold and take charge of conversations with her healthcare team, and I took note of her most important concerns to discuss with the oncologist myself. So she ended up making a meeting and a face-to-face and telehealth conference with both of her oncologists, her partner, to discuss her concerns, her goals, and how further treatment would meet those needs, and not just discuss statistics and numbers. We also talked about her physical and emotional concerns, things like pain, sleep, depression, what she's tried, what's worked, what hasn't, what she'd want to try in the future. And I brought all those concerns to the care team and suggested potential interventions and implemented what we could. Without the confidence and skills instilled in me via my CNL education, many of these things wouldn't have been able to be accomplished, and the patient may have continued to face hardships in her care. A CNL is so much more than a nurse. They're a collaborator, decision maker, and evaluator, and without us, critical pieces of patient care could definitely be missed.